Hello, friends, and welcome to episode 567 of the Juicebox Podcast. On today's show, Constance is here. Constance has a number of medical issues. One of them is type 1 diabetes. I went back and forth about whether or not this should be an After Dark episode because one of her problems involves her private lady area. But you're all adults, you can handle it. There's no reason this needs to be an After Dark episode. When I was recording it, I felt like this episode started slow and finished strong. And when I went back to do the edit, I agreed with myself. So, there you go. I agree with myself. Please remember while you're listening that nothing you hear on the Juicebox Podcast should be considered advice, medical or otherwise. Please always consult a physician before making any changes to your healthcare plan or becoming bold with insulin. I think you're going to like Constance. I found her to be genuine and very sincere. I have a couple of seconds here, so let me remind you, t1dexchange.org/juicebox. Go take the survey. It takes less than 10 minutes. You just have to be a U.S. resident who is the caregiver of someone with type 1 or a U.S. resident who has type 1. You answer some simple questions, and poof, just like that, you've helped people with type 1 diabetes. This show is sponsored today by the glucagon that my daughter carries, Gvoke HypoPen. Find out more at gvokeglucagon.com/juicebox. Today's podcast is also sponsored by TrialNet. TrialNet is available at no cost to relatives of people living with type 1 diabetes. It is a risk screening that identifies type 1 in its earliest stages, often years before symptoms appear. Early detection allows you to take steps to try and change the course of the disease. TrialNet.org/juicebox. Tell them the Juicebox Podcast sent you.
I'm Constance. Constance West currently. I will eventually change my last name. I have been a type 1 diabetic for 13 years now. And I just have like a complicated medical history. I don't know. How do you?
No, I know it's hard to introduce yourself. Wait, but I loved what you just said, and I'm trying to figure it out. You will change your name eventually?
Oh, yeah. Sorry. I got married in February.
Oh, I thought you were like, I will make a conscious decision to change my last name at some point. Or I was thinking, you were thinking, I think I will get married.
Oh, no, I am married. Oh. I'm a married woman.
Oh, you're a married woman.
I sure am.
Well, I'm a married man.
Great.
How old are you, Constance?
I'm 26.
26.
Yeah. I was 13 at the age of diagnosis.
Okay. All right. So you're right at you've split your life now. 13 years with, 13 years without.
I have. And it was really funny. The day that I had my 13-year anniversary, I was working at the hospital that I was diagnosed at. And it was kind of crazy. My job, I work as a certified nursing assistant at one of our major hospitals in the area. I'm not going to say the name because I don't think I can. And I worked there for 5 years. But I was diagnosed there, and it was good to be there. Like, I'm running around crazy, doing my job. I'm on my feet for 12 hours straight. And I texted my husband, and I was like, there better be cake when I come home. I was like, if any anniversary date I need cake, it's today. And he had gone out, and we have a bakery close by, and he had gotten me my favorite piece of cake, and I just sat at home, and I was like, okay, this is good. I'd never spent my diabetes anniversary actually working before, so I think it was good to come full circle and just 13 years previously my life had changed forever.
Yeah. Did you have any like flashbacky moments during that day where you walked around? Did you remember things?
No, our hospital has changed completely in the 13-year time frame. We have like 2 new wings, and the emergency department is no longer where it used to be. And so there were no like flashbacks. It was really funny when when I was diagnosed, well, my diagnosis story was I had just started junior high, and junior high up here starts in the 6th grade.
Mm-hmm.
And so you're at a school with 6th graders to 8th graders. No, sorry, 7th to 9th graders. Hi, Bubba. 7th to 9th graders. And
that was a child, right? Because if not, your dog can speak English.
No, that's my dog.
Oh, really?
Yes.
What did it just say?
Mom.
It did, right?
Yeah, he says mom. They both say mom. They're German Shepherds. We have a boy German Shepherd and a girl German Shepherd, Lucy and Atlas, and they both say mom.
Constance, I don't want to panic you, but there are aliens in your house posing as German Shepherds, and you should probably run away right now.
Well, I mean, Lucy alerts me to low blood sugar, so she's fine.
Does she say anything when it happens?
No, she will jump on my chest, and usually, so Kyle, my husband, works evening shift, or actually they moved him to night shift recently. So within the first 3 or 4 months we got her, he was working a lot of overtime. And one night she just jumped on my chest. And I mean, she was probably 35 pounds at the time.
Uh-huh.
And she would not get off of me. And I finally did check my blood sugar with not with my Dexcom at the time. And my blood sugar was low. And she's continued to do that. So she will alert me at my lows when I'm sleeping and my pump doesn't catch it or my Dexcom doesn't catch it fast enough.
Because it's an alien. Listen, I know you love her and everything, but you have to leave the house. Your husband works at Area 51 overnight, and he brought the dogs home. Is all this correct?
No.
I feel like you're lying now to protect the dogs.
I mean,
that's crazy. So you have a diabetes alert dog that chained itself?
Yeah.
No kidding.
And so when my head hits the pillow, I'm so busy. When my head hits the pillow, I'm zonked. I'm out.
Mm-hmm.
When Kyle's home, we'll lay down to watch a movie and I'm gone within the first 5 minutes. And so whenever she will jump up on the bed and she'll start whining, he always pushes me and is check your blood sugar.
Oh, how lovely and sweet. It's as if you're newlyweds almost. What a lovely story.
Yeah.
So the dog, I'll fall asleep from working so hard all day. Then the dog will wake my husband up to let him know my blood sugar's low, and he kicks me. Just like you imagined at the wedding, don't you think?
Yeah. I mean, we've been together and living together for 3 years, so I mean, it's not really any different.
3. You imagine all the people listening are like, the shine rubs off in 3 years? Does it really?
Oh, God. Yeah, we've only been married since March. I don't know. It's no different than when we weren't married. So
he kicked you when you were single as well?
I mean, is it single if you're in a relationship and you live together?
I mean, I think technically it is. Yeah.
Oh, I don't know. I always thought of myself as married to him anyways because we were just together.
Well, you're a hippie though, Constance, by way of where you grew up. So I can't trust
a hippie.
I can't trust your social construct ideas because.
No, that's not a norm over here. I can tell you that for sure.
Oh, living with one person.
Yeah. Nope.
All right. So you're 13. You're diagnosed. It's only 13 years ago. So you came out with good insulin, right? What'd you get?
We got Humalog and Lantus. Actually, can I just backtrack for a second?
What if I said no?
Story.
Constance, what if I said no?
You can say no.
No, I'm just teasing you. Go
ahead. In the hospital, I did have this last anniversary in March. It was really funny when I was diagnosed. So we had been trying to do a workup for actual cancer because I was so sick and there was not really anything that the doctor could figure out my PCP. And mono was also going around at the junior high I was in. And so this was a several week thing. I was so tired. I was not really actually peeing a lot. I was drinking a lot. They couldn't figure out what was going on, but they never did a glucose test. And then all of a sudden, one day we're in there and they're like, oh, we ran an A1C test. And I actually found the A1C. Your A1C is 10.3. You need to go to the hospital. So we go to the hospital and like we're in the emergency department and we're waiting for the endocrinology team to come back, and some like general surgery resident is just like looking at me to make sure I'm okay as we're waiting for endocrinology to come down from clinic. And he goes, open your mouth, because they're doing their system check. And he goes, oh my gosh, your uvula goes the wrong way. And then like I had a whole herd of residents who came in and out of the emergency department room as I'm waiting to see endocrinology, and they all just wanted to like wanted me to open my mouth and check my uvula, because they'd never seen a uvula that went forward and not backwards.
Listen, does it still do that?
Yeah.
Is that the first time you were aware of it?
Yeah, and so that will like that every year will get me, because that's really what I remember from that day.
Or uvula goes the wrong way. Oh my gosh. That's so bizarre. It can't even be the title of the episode. One time, Constance, somebody said to me, can I tell you a funny story? And I was like, yeah. And they told it. And I thought the whole time they were telling it, I was like, this is not funny.
Yeah, maybe that wasn't funny. It's always funny to me, though. Yeah, my uvula goes the wrong way.
No, I was amused this time. I'm just telling you, there was the one time while the person was telling the story and all I could think was like, this is not funny at all. So tons of people look at your uvula. I also am interested, and I think everybody should be. You can tell a person who's living with autoimmune issues because you're like, want to hear a funny story? People thought I had cancer, but it wasn't. Anyway, I just have, and what do you have? You have type 1, but you have other stuff too.
Yeah. So I have type 1 diabetes. I have Hashimoto's. I always forget. So I had been told that I have Sjogren's disease, which is your immune system attacking your glands that secrete, so like your mouth, and then the vagina. Sorry, I'm going to say that word a lot. And then lichen sclerosis, which is the immune system attacking the genital tissue. And
okay, so you're a little soft-spoken. So let me just say a couple things first. So I never can say this because they put dots above letters, and when they do that, you've lost me. But Sjogren's disease? Sjogren's, a disorder of your immune system identified by 2 most common symptoms: dry eyes and dry mouth. Do you feel like you have that, or you're just somebody told you do?
No, so I do have dry mouth and I do have dry eyes. And then they can do an ANA, an anti-nuclear antibody test, which is like kind of the standard. And at the time that I was told I had that, it was showing positive. Maybe it was for something else at the time. But I have a neurologist that just went and did labs, and my ANA is completely negative. So he's like, I don't think you have Sjogren's anymore, if you ever even had it. But I do have constant dry eyes and constant dry mouth.
Can last for years or be lifelong. Now, The next one, lichen sclerosis. Lichen sclerosis?
Yes, lichen sclerosis, or we can call it LS because it's also called that.
Why don't we do that so I don't have to say sclerosis again? Is a long-term skin condition that mostly affects the genital and anal areas. It causes your affected skin to become thin, white, and wrinkly. It turns you into my grandmother. It is due to inflammation and other skin changes in the affected area. Common symptoms include itching, irritation, and painful sex. Wow. Yay. Yeah. Less than a rare condition, by the way, which always makes it feel worse in my mind because they're like, all the countless millions of people on the planet, only 200,000 a year get this thing. And they're like, great. So what's your first diagnosis in your life?
Well, I also have pelvic floor dysfunction.
Hold on. Pelvic floor dysfunction. Well, that pops right up on Google. That's interesting.
And then my pelvic floor muscles are hypertonic.
Your okay. Your pelvic floor muscles are hypertonic,
Yes.
and that doesn't mean they're like a bubbly drink at all.
No, so just like high blood sugar, hypoglycemia, they are constantly contracted.
Contractions.
They're high tone.
Oh, okay. Pelvic floor contractions can also be measured internally with a periometer, which is a tampon-like sensor that can be placed in the vagina or rectum. I mean, they say only go one way with that. A defecating protractum can also be used to diagnose pelvic floor dysfunction. Have you had this test?
Yeah, so it's what is it called specifically? A urodynamics test. So they like go in, and what they do is they put a Foley catheter in to the urethra, and they start filling the bladder full of normal saline, and then they also have the little probe that you were saying in the vagina, and then they measure how much the bladder can hold before it starts contracting and then making the pelvic floor muscles contracting. And at that time, my bladder could only hold 62 mLs before it started having contractions equivalent to childbirth. And so 62 mLs is 2 ounces.
Okay, let's go slow because this isn't happening to me and I'm getting upset. Let's go with, what was your first diagnosis and how old were you? Was it the diabetes?
It was a diabetes at 13.
Okay, which now seems like passé, if I may say. I'm like, oh.
You know, honestly, yeah, my diabetes is the only thing. Like, people are like, "How do you do it?" I'm like, I don't know. Like, how do I not do it?
Yeah, I mean, honestly, it probably is the least of your issues, right?
Yeah, I think so. I mean, other than like when you have a really low blood sugar and you feel like shit.
Right. No, I understand. And by the way, it's cool that you cursed because you got you're supposed to go, you can go from one way to the other, but not the other way joke earlier. And you laughed under your breath and I really appreciated it because it's early in the morning. We should tell people it is 8 a.m. here. It's the earliest I think I've ever recorded an episode. Not to say that it's super early, but it's 5 o'clock where you are, right?
Yeah.
Yeah. Right. Yeah. So thank you very much for doing this like this. It was, and what happened? You had a doctor's appointment and we kind of got our things messed up, but my schedule's so full, like there's not a lot of options. So
Yeah. I have a doctor's appointment and I thought that it was Eastern Standard Time, 8 a.m., which I was like, yeah, fine, 5 a.m. my time, no problem. But it was Pacific Standard Time.
Yes, it's no big deal. I'll sleep tomorrow.
Great.
Yeah, it's not a big deal at all. Actually, I'm joking. I'm fine. I think you might give me a nice day. I should probably get up earlier to begin with. Now people are like, wait, he's not up at 8 o'clock usually? I am up at 8 o'clock. I'm just not usually working at 8 o'clock.
Yeah.
All right. So what comes after the type 1?
What was really cool about my endo, she was constantly, when they would draw the A1C, she would also draw T3 and TSH. And so she caught my not even Hashimoto's, but hypothyroidism really early. So I was on 27 micrograms of levothyroxine until from I think it was 15 I was diagnosed with that. So 15 all the way to 20 before we even need to do a dose change.
She caught it really early then.
She caught it super early.
Yeah.
And then from 20 to now, it's just been a freaking roller coaster of trying to get it under control. And I think we finally have. And
are you doing it just with T4?
I do levothyroxine and then lithothyroxine, lyothyronine.
Is that a T3?
Yeah.
So not Cytomel. Had you tried Cytomel?
No.
No? Okay. So it's just a brand thing. So now you have for people who don't understand, we're going to test my remembrance of this. You're not making the T4, but you're also having trouble picking it up, right? So the T3 helps with that. It's all in the thyroid episode, people. It's one of one of the stranger things that I'm not good at remembering is the
Yeah, so
functionality.
I believe if my nursing education has stuck in my brain long enough, T3 is converted to T4 to go to the cells.
But there's something about when you don't convert it, or when you don't pick it up well, you can take.
Right.
Yeah.
Right.
Do
And
you-
I think what it is just it's not fast enough.
Mhm.
It just doesn't work fast enough. And I have seen a difference since starting the liothyronine. Like I've always had fatigue, and the fatigue is a little less. Again, I'm a very busy person, but I'm just constantly fatigued. If I could sleep all day long, I would probably sleep 20 hours a day.
Yeah, that is a real serious implication of thyroid issues, that people are just, they're tired. Even when they get their medication right, they can still be tired. Yeah. Did T3 give you a little kick or no?
It does. And so we just saw my endo last week, and I was like, can we titrate down on the TSH and go up on the on the T3 medication? I was like, I just want to see if that's more helpful, because at this point it's working, but could it work better?
Right.
I like to push boundaries.
Yeah, you have to be careful with the what is it I'm thinking of? Like you can start getting like teeth grinding or heart palpitations, jittery, stuff like that.
Yeah, there's a very narrow therapeutic range for thyroid meds. So I'm aware, and I do get those. If the dose is off at all, I will get them, and they will come full force. And I just message and ask for labs, and then we adjust. But she was like, yeah, we can do that. And it should be about the same amount that your body should normally make, but your thyroid's toast. So
yeah, great. Okay. So did you have any other problems like in those years getting it together where did your hair keep falling out, or did you have issues with weight or anything like that?
I never had issues with weight until recently. I've always had thin hair. It does get thinner. They did find a nodule on my thyroid, so we get that checked every year and make sure it's not cancerous.
Well,
but yeah, just like it.
The nodules,
Sorry?
I'm sorry to cut you off. The nodules indicate Hashimoto's.
Yes.
Right. And that's a common, if you have Hashimoto's, you will likely see. So what do you get, like ultrasound?
Yeah, but they also tested for antibodies, and they found them, which was the confirming diagnosis, because you can have a nodule without having
the antibodies.
Yeah.
Right. Okay. All right. So what came next?
What came next? The Sjogren's.
The Sjogren's was next. All right. So can you kind of put into context for people, like dry eyes, dry mouth? Is it a constant? Is it something that flares? How does it present?
Yeah. It kind of, the dry mouth is definitely constant. And so what they tell you to do is to like eat a candy. Keep your mouth full of saliva by eating candy throughout the day. Sorry, I have diabetes. I can't just eat candy willy-nilly. So that was never an option. So chewing gum was how I would try to keep it kind of wet and keep your mouth with the amount of saliva it's supposed to have and secrete enough saliva to be able to eat. And then the dry eyes, it can be intermittent, but like from spring all the way through summer, usually it's pretty bad when it gets drier.
Do you have to use like wetting drops, or is it painful?
And when it gets really, really bad, I have specific ones for immune suppression of the lacrimal gland, I think it is, of it to like actually moisten the eye. I'm not exactly sure how it works, and I could have just said the completely wrong thing. But yeah, so it's like an immune suppressant drug for your eyeballs. And so when it's really bad, I use those. But yeah, there's not really anything else that they can do for it.
Is the dry mouth just irritating, or I guess it could have other impacts too, right? Like you could end up with like more cavities because of that?
Right. And so that's what happened was I got more cavities, and I maybe the Sjogren's has been lifelong and it just intermittently, and not that it would just decay my teeth. But by the time that I was 18, I had so many cavities. And at this time, I mean, I was looking, my A1C when I was diagnosed was 10.3, but I can go back and see labs all the way back. And the highest that I ever had after that was like an 8.6. Okay. So my diabetes has never really been out of
whack.
It's been out of whack if you ask my parents, but whatever. And my diabetes should not have caused the dry mouth or the decay in my mouth that happened. And so by the time that I was 18, I had to have like $30,000 worth of dental work done, which insurance did pay for, which was great. Because there was just so much decay going on. It's so fast. Mm-hmm. And then at the age of 21, my two front teeth, I was working. I think I was at work and I was eating something, and just both of my two front teeth just snapped.
Holy crap. Wow.
They just snapped. And I had a couple of other cavities that were working their way through on the upper and the bottoms after all of this dental work 3 years prior. And so we went into the dentist, and the dentist was like, well, we can spend another $30,000 trying to fix all of these, or we can just take all of your teeth out.
Okay, I'm going to put the ads here, but trust me when I tell you, Constance is just getting going. The really crazy stuff is yet to come. Gvoke HypoPen has no visible needle and is the first pre-mixed auto-injector of glucagon for very low blood sugar in adults and kids with diabetes, ages 2 and above. Not only is Gvoke HypoPen simple to administer, but it's simple to learn more about. All you have to do is go to gvokeglucagon.com/juicebox. Gvoke shouldn't be used in patients with insulinoma or pheochromocytoma. Visit gvokeglucagon.com/risk. So all week I've been telling you what people on the private Facebook group have been saying about the advertisers. And TrialNet is no different. Jamie says that after her son's diagnosis, she had her oldest son and herself tested, just for the peace of mind. Katie tells me that TrialNet was able to help her keep a very close eye on one of her other kids, and that her daughter was able to be diagnosed and start insulin very early because of TrialNet. She says we avoided DKA or even a hospital stay. Jill says that TrialNet helped her to know what was potentially coming with her kids, and due to that, they didn't have to be hospitalized when officially diagnosed with type 1, and they never went into DKA. Boy, this story pops up over and over again here. Kerry says TrialNet helped with an early diagnosis for our son, 18 months after the diagnosis of our daughter. There's a lot of sentiment in here about TrialNet. I'll tell you, it's absolutely free. You can do it one of 3 ways. They'll send you an in-home test kit. You can go to a lab for a test or visit a TrialNet location. It's really worth your time. TrialNet.org/juicebox. At some point during the process, they'll ask you where you heard about them. Please say the Juicebox Podcast, then complete the testing and send it back to them. And that's when the show gets credit, when you send it back or go to a lab, not when you just order it. So if you guys are out there wanting to help me, just ordering it's not going to help. You have to complete the process. TrialNet.org/juicebox. T1D family members are at a 15 times greater risk to develop type 1 diabetes than the general population. T1D risk screening will detect if you are in the early stages of T1. If you are identified as at risk, TrialNet is here to help you. They have prevention trials if your screening results show that you are in the early stages. You may be eligible to join a prevention study that is testing ways to slow or stop the disease progression. And you're eligible for ongoing monitoring by top type 1 diabetes researchers. And if you happen to develop type 1, being monitored in clinical research studies, like you heard from some of the listeners, decreases the chances of DKA. TrialNet says from 30% to 3%. TrialNet.org/juicebox. There are links in the show notes of your podcast player and at juiceboxpodcast.com to TrialNet, Gvoke HypoPen, and all of the sponsors. When you support the sponsors through my links, you're supporting the show. I really appreciate that. All right, let's get back to Constance and really dig in.
And give you dentures.
Constance, I have to tell you, when I said that, I didn't know that. I have my hand up like I have it on the Bible in a courtroom. I just when I heard dry mouth, I thought, oh, like, you know, if people sleep with their mouths open, for instance, a dentist will say that's one way you might end up with getting a cavity because the bacteria and you feed it with it anyway. But I didn't know you were going to say all that. That's insane.
Yeah.
Wow. No kidding. So they just took out your teeth and set you up with dentures. How old were you then?
21.
Happy birthday. Well, so yeah, a lot of people go out drinking or some people get dentures. So I'm going to stop for a second before we get to the other issues and ask you, by then, 5 years ago, 21 years old, what's the psychological impact on you with all this? Like, how do you handle this?
You know, it's just the card that I was given. There's no way to handle it. I can't stop and break down. I do stop and break down. Like when something's really affecting me, I do. And I cry and I cry and I cry. And my poor husband will just sit there and try to help me. And he has no idea what to do. And then I get up. Literally, it'll be like, okay, I'm done crying now. I'll get up and I'm like, okay, well, I gotta go on. Gotta keep doing what I gotta do. Yeah. And that's it. Like and my motto is like, every day gets better. Like, yeah, today, right now, this feeling sucks. It sucks, but I'm doing things that will have a prolonged effect in my life. And hopefully I won't have to be here forever. And it is just kind of like what gets me through the day. I will say, you usually ask people if there's any other autoimmune funky stuff going on in families. I'm the only one with anything wrong. Well, I am one of 6 children.
Okay.
My parents don't have any siblings. Their parents are mostly all dead. But there is nothing autoimmune. Oh, sorry. My great grandfather, we learned before he passed away that he had hypothyroidism, but it wasn't until like way later in life. He had only been on it for like 2 years.
What about just like dental issues, even that?
I mean, my dad had dental issues, but his were due to a dentist in his 20s leaving like a needle in his gum.
Oh, yeah. Okay. Don't say that again. Okay. Look, none of us want you to say a dentist left the needle in your dad's gum again, because that is going to kill that was the chilliest thing anyone's ever said to me on the podcast. I was like, it just ran right up my spine. I was like, oh, okay. All right. Hold on a second. Well, the truth, wow, you really got me with that one.
Sorry.
The truth is, no one else in your family can have an autoimmune disorder, Constance, because you took them all. Okay.
Literally. I joke with people and I'm like, I just won the genetic lottery.
Yeah, you're greedy and you took every one of them. Okay. So we're left with what can I guess was pelvic floor next?
Yeah.
Wow. Look at me. Getting good at this. All right.
Well, I would say no. I would say these things. So I would say pelvic floor dysfunction, as long as I can remember, is the same as the lichen sclerosis. And I'm going to say with the lichen sclerosis, the only way to actually make a confirmation for lichen sclerosis is they do a biopsy of the skin tissue, which might give you a tingle as well up your spine. So they did one recently. But I have been on topical steroids for that in the area for well over a year, and they had me stop for 2 weeks, and it came back as contact dermatitis, which is just inflammation of the tissue. And it didn't come back as lichen sclerosis. But with the way that my tissue clinically looks, the doctor's like, we're just going to retest in a couple of months if you can handle being off the steroid and see if it comes back positive, because she's like, there's no way this isn't lichen sclerosis. But the only way to like actually get the tissue to kind of go back to its normal is just off the steroid. But let's go back. Pelvic floor dysfunction and the lichen sclerosis. So for as long as I can remember, I would tear in the genital area, and not like real bad, but it would just happen, and then you do a little aquaphor and it heals. It's fine. And pelvic floor dysfunction. I have always had like heavy periods, which is part of the hypertonic pelvic floor. And so basically what it is like my pelvic floor muscles, they're a big bowl, and they hold the uterus and the vagina, and then it holds the bladder and everything kind of below the diaphragm up. Well, mine is literally like up above my navel, basically. Like my pelvic floor is so far up. It's so tense. It's so far up. And so it's always caused issues with sex. I just didn't know that was a thing. And so 2 years ago, I, out of nowhere, got a kidney infection. And I think that kind of threw it all for a loop, because since getting that kidney infection, and I honestly have no idea where that kidney infection came from. I actually think it's from one of the lakes here, because I was swimming in the lake a couple of days prior, and there was no way that I've never had a kidney infection before. And so I go in because I started peeing blood one night, and they do the scan and everything, and they're like, yeah, kidney infection. And it gets worse, and it gets worse because like when you go in with your symptoms, it takes 3 days at least for the antibiotics to kick in. And it was over a long weekend. So of course you can't get in to see anybody right away. And the antibiotics weren't working. Kidney infections are so painful. Yeah. And then once that was relieved, I always had and my urethra would burn. And so I was still having that symptom of this burning urethra on and off. And then I started having cramping that would literally drop me to the floor. And so I was referred to a urogynecologist, and they did a cystoscopy, which is putting just fluid in the bladder to check if there's any tears from the infection, and there wasn't. And so they kind of just sent me on my merry way, and said, here, take this medication if you are having the urethra spasming, and you'll be fine. So I dealt with that up until last July. So we're talking like a full year.
Wow. I have a couple of
those
questions.
Symptoms.
So the steroid medication and the issues with the LS, is that internal or external?
That's external.
External. Okay. And hold on a second. The pelvic floor, like what are the real world implications of it? Like in your day-to-day life, how does it impact you?
Yeah. So, we can't have sex. I will just have spasming, and again, it'll kind of just like drop. I kind of have to like drop whatever I'm doing. It used to literally drop me to the knees. It doesn't do that anymore. So I have like a team of doctors that we're all kind of like working together, but not in the same clinic. So not actually on the same team, but so we had COVID that hit, right?
Right.
And so I went from not seeing my PCP at all, and I couldn't get into an appointment with her. Like they weren't doing in-person appointments, but I had a tear that happened in March of last year. Yeah, March 2020. That lasted all the way till like middle of June. And I mean, it was pretty deep. It was pretty bad. And like Aquaphor wasn't working. And so I called the office and I was like, I need to get in. I need to see somebody, and I need to see somebody in person because I need somebody to look at this. Like, this is no long, like, it was so hard because it's like, oh, we're in the middle of a pandemic, and the pandemic was so new at that time. But I was like, I cannot do my daily activities of living because it is just so painful. And so I went into my PCP and she looked at it and she was like, this is not my specialty. And she sent me back to the urogynecologist. And the urogynecologist was asking all of these questions, and just questions that they hadn't asked before, or maybe I wasn't getting the right answers. It's so hard to know which it was. And she was like, okay. She looked at everything and she was like, oh my God, this is not my wheelhouse either. Like, I cannot help you here. But I can help you with the like urethral spasming I was complaining of and feeling. And so we scheduled another follow-up appointment. Once I got the confirming diagnosis, she sent me to the vaginal dermatologist, a vaginal dermatologist.
Which none of us knew there was.
I had no idea.
Yeah, right.
But the funny thing was, like, I went to the vaginal dermatologist, but 2 days prior, I had gone to a dermatologist as well because I had a couple of moles that popped up and were weird and they were scaring me. So I went into the dermatologist and she didn't look at my vaginal skin at all. So this vaginal dermatologist looked at everything and she was like, yep, this is lichen sclerosis. But the urogynecologist had already started me on, it's called clobetasol, the topical steroid. And we were doing that at that point because I think it took 3 weeks to get into her. I had been doing it every day for 3 weeks, which was too much of it to get a biopsy. Okay. So can I
ask you a couple of questions? So when you say you can't have sex, is that constantly or during flare-ups?
I have not had a time that I've not been flared up.
Okay. And so when you, I'm assuming you've tried sex?
Yeah.
What happened?
What happened? It's so funny. Prior to this pelvic floor dysfunction, my husband had a couple of like long-term girlfriends prior to me. We're actually like old high school sweethearts, which is an old story that takes quite a while to tell. But he had several girlfriends, and he was like, I've never not gotten them to orgasm, and I've never orgasmed so fast, because my husband, oh my God, he'll orgasm in 2 seconds. I'm not kidding you. When he gets inside of me, it's the worst thing ever, especially if I'm trying to enjoy myself. And so we always joke that there was something wrong with him. I was like, there's something wrong with you. We need to get you into some sort of therapy so you're not just going every 2 seconds. Come to find out, it was me. So, it was my body.
So you're trying to have intercourse and you're in pain.
I'm in pain. Yeah.
But the implication to him is there's like 7,000 vaginas on him, like, and doing the hard work. And so he can't like, okay. So I'm going to have to beep this out, I imagine, but so you're like amazing at stuff, right?
Ew, no. No, it's funny. I don't know if this, when I was 18, I was doing my CNA classes, and the first time I actually ever saw a penis was when they were shoving a urethral catheter in it, down at one of our major hospitals, and I was like, gross. So penises really grossed me out, honestly, if I'm gonna be honest.
Let me ask a serious question on that. Was it hard to date for you because of all of your issues?
Hard to date. I've never been one to like date. If I went on a date with a boy, it was because I already liked them and saw something in them that I thought would be acceptable as a boyfriend. I had one relationship that lasted 4 years. And then the one previous to Kyle was a year and a half, and he ended up ghosting me just out of nowhere. And then I've been with Kyle for 3 years.
So what do? Do you just take one for the team once in a while?
Yep.
Oh,
sure do.
Oh, I'm sorry.
Yeah. I mean, he tries. God, he tries as hard as he possibly can. And so we can have sex. I don't want, let's see. How do I explain this?
I don't know, but go ahead and try.
Yeah. And I have no qualms about explaining it, but let's see. Okay, so things will get, there will be touching, and touching is sometimes okay. I really have to be in the right mindset. I have to be calm. They gave me some muscle relaxers that are really helpful. So it's not like we can't just out of nowhere spontaneously have sex. I have to take these muscle relaxers 45 minutes to an hour beforehand, which does not work very well with my husband when he wants to have sex.
Well,
he's like, no, let's do it now.
You should turn it into cardio. You take the muscle relaxers, then run away from him for 45 minutes.
Something. But the muscle relaxer really does help. And so I'll take the muscle relaxer, and it kind of, that will help relax everything. So he will touch me and try to get it, and like it'll take a while to get the juices flowing. How would you say? Yeah, vaginal juice flowing.
I have to be honest with you. I think if I said that, I don't think it would go over well. But I'm sure it's fine that you said it.
To get the vaginal juices flowing. And once that is, we're okay. Then he'll try to penetrate.
Right.
If you want to get technical, and if he doesn't come within 10 seconds, my body will actually reject him. Like my muscles will reject him out of my body.
No kidding.
No, not kidding at all. It happens all the time.
Okay. Hold on. Do you, I'm asking because of the part of the country you're in, I guess, more than anything. Have you tried like drugs, like recreational drugs?
No, I don't do drugs.
See, you don't seem like a person who would try that, but I wanted to see if it was bad enough that I honestly thought to myself that was going to be your answer.
No.
But I just thought maybe have you ever talked about it?
Like in therapy?
No, like between the two of you, like maybe we should try smoking weed and doing this or something like that.
Oh, I mean, my husband smokes weed. I just don't, I could get drug tested at any time. I'm in nursing school and I'm also working.
Okay. So not that I'm saying to do this, but does alcohol have any impact on it?
So I can't drink alcohol either because I also have chronic yeast infections.
Of course you do. Right. No, I don't know why I didn't just assume that. I'm sorry.
Literally chronic. From well before even being diagnosed with the diabetes, I can remember having yeast infections, and they've been ongoing since. So it's like this with my, which is the reason I emailed you and asked if you wanted to do a After Dark episode. So like I have the chronic yeast infections that have never gone away. I have stumped every infectious disease doctor I've seen. We're still trying to figure it out. And then I have the lichen sclerosis, which came back as contact dermatitis, which is its own thing. And then the pelvic floor dysfunction. When I have a fissure, when I have a tear, which is another word for it because it fissures and tears, the yeast gets inside it, makes it more inflamed, which sets off my pelvic floor.
Oh, wow. All right. Well, this is an After Dark, so I'm gonna ask you another question that seems like an obvious question. I'm pretty sure I know the answer to, but I feel like we need to understand fully. Do you do it?
No.
I wouldn't either, by the way, if I was you. I just thought I would ask. Are your hands super soft? How does this work?
My husband's just really patient.
Well, no, he's a saint. I'm pretty certain. And by the way, I'd smoke weed if I was
it's so funny. It's so funny. Our girl dog Lucy, she's in heat right now, and Kyle told me as I was leaving for work yesterday. He was like, she got on top of Atlas and started humping him the other day, and I was like, Same thing when I'm trying to have my period. I just want to hump you.
So
I was like, it's the hormones that are released. And he was like, yeah, it's dumb. And I just left.
But none of this impacts your desire, though. I mean, I assume psychologically.
No, I love my husband. I want to have sex with my husband.
Right.
It just doesn't, my brain doesn't work with my vagina.
Do you do stuff to, I'm just going to ask you, like, do you do things that, like, do you, like, bring, like, the back of your knee into it? Or, like, what do you do to, like, I don't even know what to say. I'm at a bit of a loss here. I only know the classic ways to do it. So, but do you see what I'm saying? Do you guys get, like, try to figure something out? Or do you just...
I mean, we've definitely tried. So I in October, I had surgery. They put in a nerve stimulator of my sacral nerve. So, like, usually they'll do this for people because pelvic floor dysfunction usually happens after pregnancy, right? And it usually happens in the elderly population.
Mm-hmm.
And again, that's usually hypotonic muscles where they have just been too stressed, either due to age or pregnancy, that they are not tight enough. Mine are too tight. So if we were to turn on the video, I could show you, like, usually your pelvic floor muscles actually sit in your pelvic floor where you're, like, the legs connect, it sits there. Mine sits above, like, my belly button, basically. Yeah. And so the pelvic floor muscles then move kind of like all of the organs up with it, you could say.
Wow. Constance,
so we had,
when you said if we had the video on, you could show me, you meant with your hands, not you were going to show me your vagina, right?
No, I don't want to know. You don't want to see that. Believe me, I've never personally seen it, but I'm sure you don't want to see it.
I just have to tell you, like, because if that's where you were going, I've recorded like 600 of these, and that would have been the first time somebody said, if you want, I can flip this on and show you my genitals. But no, I knew you meant like you were making some hand gestures that you wanted.
Yeah. Anyways, we did this, like, diary log of me peeing and, like, the spasming I was feeling. And at that time in October, I was peeing like 16 times a day. I'm in my first semester of nursing school. I'm driving 3 hours at least every week. I work a very high demand job that I'm on my feet for 12 hours, 2 days a week right now. Mm-hmm. And I'm going to be a bedside nurse. You're on your feet for 3 shifts for 12 hours a week once I'm done with nursing school. Going to the bathroom 16 times a day is not effective to get any of that shit done. Right. Like, let me just be clear. You're in the bathroom, your urethra is spasming as you're trying to stop peeing, and then your pelvic floor contracts, and it's just, you end up sweating sitting there on the toilet like you've just eaten really bad takeout, like,
right,
16 times a day.
I love
16 times a day.
I want to tell you something. There's something interesting going on about you, right? Because at your core, you're kind of a proper young lady. And
no, I'm not.
Hold on. But you have so many things going on. You really don't have the time to be proper. And right. But I think do you think if none of this had happened to you, would you be a little bit of a teetotaler, or do you think you'd be going crazy? Like, what do you think your core feeling is about life?
My core feeling about life? I think, my sister's kind of like me. I think I would kind of be the same thing. I just have a lot less shit going on. Yeah. No, but your attitude is impeccable, by the way. Like, seriously, you have so many things going on with you that if it was the 1600s, people would think you were a witch and put you on trial. Like oh yeah, for sure.
100% you'd be at a witch trial. So, she makes men's penises explode.
Oh my God.
I think that alone would have gotten you burned. So, but you have an amazing attitude. Like, even wanting to, like, tell somebody about this is really lovely, because you're not the only one, I would imagine. And I can't imagine that a lot of people are excited to run around and tell these stories. And your husband is obviously a person who loves you, which is that's lovely in and of itself. especially when I asked about the mouth stuff and you said ew, because I just assumed that's how you guys got through.
No, he'll ask me and I'm like, nope, not today.
Yeah, he's a boy.
No.
We ask constantly. It's literally
I'm
on
like,
the front of our head. I was at a funeral once, and it's what I was wondering about. So,
oh God,
we're tortured.
no, I'm like, you have Lefty. Like, go hang out with Lefty.
All right. Do you make most of the money?
Not currently, he
Okay.
does, but I will in a year.
I was just thinking, like, maybe he was like, all right, but such a good earner, this Constance. What made you want to be a nurse? I'm assuming having scads of medical issues?
No, it was definitely the care that I got in the hospital when I was diagnosed, because the diabetes educators that I had, as well as until I was 18 with the care that I had at the hospital, was diabetes educators. So they were just wonderful. And I hated my endo. That whole entire 5 years, I had the same endo, minus the times that she was pregnant. She was pregnant like 3 or 4 times when she was on leave. But my diabetes educators were just wonderful. And I find, as a type 1 diabetic, at my core, because if you really were to boil me down to one disease, I would just say type 1 diabetes, because it's my longest lasting disease. It's not going anywhere. It can affect everything else. And I just want to be helpful to future diabetics and families. And I think that's why I enjoy listening to your podcast so much, is because you speak so much truth. And like diabetes educators, and a lot of time it's because I can't speak truth of what diabetes is actually like, and the peaks and the valleys. But just being that person and knowing that these families who are going through it's traumatic. It's so traumatic. Having diabetes on a daily basis, I feel like, is traumatic. Some days, not every day, but it can be traumatic. And just having somebody to be like, okay, this is what we're seeing, this is what we're doing, what's not working, because we would do that with my certified diabetes educators, the nurses, because they had diabetes for forever. One of them, her name was Barb. She's still actually at the hospital, and she was diagnosed at the age of 4. And so if we were ever having any problems, we would call her, not the hospital, and say, hey, this is what's going on. What do you think? What should we do?
Yeah.
And it's just, and the only way to be a certified diabetes educator is through being a nurse or through being a nutritionist. And I've taken nutrition classes. I could have become a nutritionist, but in case something were to ever happen to my husband, and I was a single mom, and I needed to find work as a nurse, you can find more work than as a nutritionist. So I went with nursing.
Good for you. That's really, I mean, it's the whole story is, I mean, it's terrible. Obviously, I have nothing but compassion for you, but the way you handle it is astonishing. Why do you think you're able to do that? It's a question nobody ever is able to answer, but.
Yeah. And doctors ask me that too. They're like, you can't be living in a body with all of this happening and going on at once. I'm like, the heck I can't. I sure am. I'm doing it, and I'm doing everything else that everybody else is doing. So, I can do it, and I am doing it. It doesn't mean I don't have times that stop me and I have to kind of readjust what I'm doing. But I honestly think it's just like, I lived for so long with the diabetes. When I was diagnosed, my thought was, okay, I'm just going to make it to 18. Like we were given basically, and this was 2008. I don't know why the doctors did this, but they were like, you're probably going to end up dead sooner than later. And
in 2008?
Yeah.
Wait.
Yeah. They gave my parents a max of 30. Is what they said.
Really?
And really, yeah. I don't know why.
They're all hippies. They're stoned out of their mind. They can't think. You guys got to stop smoking the weed long enough up there, right? Do your job.
Well, we wasn't legal then.
No, that didn't stop anybody in the upper Northwest. It being illegal. Do you think that weed being illegal stopped people from smoking weed?
Oh no,
Oh,
no,
okay.
no, no,
All
no.
right.
But I mean, everybody's smoking it now. Anywhere you
Yeah.
go,
It's just
disgusting.
everywhere. It's a cloud of
Literally, of skunk.
That's funny. Well, you guys should be able to get decent stuff. It shouldn't be that bad. No, I mean, it's just, listen, I've spoken to a lot of people, and I don't think that people have a good attitude or what would be perceived as a bad attitude on purpose. I don't think anyone's reaction is mindful. Meaning, I don't think something happens to somebody and then they go, well, let me decide. Will I be upbeat and cheery about this, or am I going to act like a prick? Like, that's not what happens. Like, whatever your reaction is your reaction. But, I mean, were your parents, like, fantastic parents? Did you have, like, an idyllic childhood until you were 13? Or do you just have, is it just a good disposition? Is there anybody in your family that has your disposition that you could point to? No. You're just going to live your life. Like, this is it. This is what I get.
Yeah. And I think, again, diabetes, because like I could literally die in the middle of the night from a low blood sugar. I have my A1C just came back the other day at 6.0. I am fine, but something could happen, my site could fail. And before I wake up, I die from something, I live my life as like, I could get into my car and I could freaking die because some moron hits me.
Right.
And that's just kind of like, I'm going to do the best that I can. I'll be here. Like, and it is what it is. Like, diabetes is not going to stop me. And there have been several people who throughout my life have tried to stop me because of my diabetes, mainly educators, and telling me I wasn't worth the time. I wasn't going to make it. I was too dumb. And it just wasn't worth their time because it would take too long and I wasn't worth it.
Constance, I've been speaking to you for 57 minutes now. You've not come off as dumb once. Why would someone think that about you?
Probably because I was 13 at the time. And all 13-year-olds are dumb.
Were you going to the where was your endocrinologist? In the middle of the woods or something? Where did you?
Seattle.
Oh. I mean, I watch Grey's Anatomy, so I think of Seattle as being the hub of good healthcare. Is that not true?
I mean, I could talk to you for days, Scott. I could talk to you for days.
Since I'm laughing at myself because I have commingled a television show with reality in my mind. I was out in Seattle recently, and
I know.
Yeah, right. And I was disturbed to find that I think Seattle Grace from Grey's Anatomy is actually a set in Los Angeles and not really in Seattle.
Yes, it is. It's not shot in Seattle at all.
People are like, do you want to see the Space Needle? I'm like, no, where's Seattle Grace?
No, it's not a real hospital at all.
Yeah, I found out. It's okay.
Sorry.
I was actually so busy when I was there, time-wise, I didn't see anything.
Well, that's unfortunate.
Yeah, I saw that mountain that finally came. I love the I think I've mentioned it in another episode, but there's a colloquial phrase that people use around there. They say when the mountain is out. And it doesn't. That's,
not Rainier.
Yes, but when the mountain is out, it isn't actually a sensible statement. The mountain's always out. It's when the sky is clear. But I get the idea, and it was lovely. Like, the first person that said it to me, I thought, like, oh, that's nice. They don't understand English. And then, that's fine. But then when the 5th and 6th and 20th person said, oh, wait till the mountain comes out so you can see it, I was like, all right, this is a thing these people say.
Did you see it? Did you see Mount Rainier?
One day I got a really great look at it, yes.
Is it not breathtaking?
It's astonishing. And I will
Y'all think the mountains are like dirt compared to us, so it's amazing.
I think the most fascinating aspect of it was that we arrived on a Saturday night, and I remember being a traffic light, and it was late at night. Like, don't get me wrong, it was like 1 o'clock in the morning, right? So my time, so it was probably 10 or 11 your time. I was exhausted. We were sitting at a traffic light. You can't see anything, obviously, because it's dark. The next day, you're out. I'm sitting at that traffic light again. I don't see anything. 3 and 4 days go by, and finally we're at this place, and I get a text from Chris, the guy that put us up for the first week, put me and Cole up, and then Cole moved on to housing. But he said, oh, when you get out of there today, you're going to see the mountain. And I was like, oh, great. And what astonished me was that in the 35-minute ride back to Chris's home from where we were, the mountain was almost always visible.
Mm-hmm.
And all I could think is we had taken this ride about a dozen times already, and I had no inclination of where the mountain was. And that was fascinating to me. Like, just to turn a corner and be like, whoa, that was not there yesterday. So I get the saying. I do get the saying, when the mountain's out, because it feels like it just decides to appear.
Literally.
Yeah, it's very cool. It really is. Anyway, is there anything else wrong with you that we didn't talk about?
Oh, God. My husband has bipolar.
Oh, okay. That's not you, though.
No, but I mean, I have a funny disposition in your thought process. Others would not. But yeah, it's funny because his is, like a chronic illness, and we just got the diagnosis in like May. Finally, we've been dealing with really bad, severe depression. And I don't get me wrong, as a teenager, I was definitely like defiant. I would make my mom mad because I would give myself insulin for my genes, or, my blood sugar would stay around 210 and I wouldn't care. And I would not check my blood sugar, but I would take my insulin. And, I kind of was just a little defiant with it. I didn't want it. I still don't want it, but I deal with it. And then one day I was like, okay, well, this is not getting me anywhere. I'd better just take care of it. And so, my definite motto is, even with everything that is going on, and even though my pelvic floor sucks and my skin is tearing, and I have a yeast issue that nobody can freaking figure out and get rid of, every day gets better. And that literally is my motto. Like, everything sucks right now, and it might suck this second, but tomorrow is a new day, and tomorrow it'll get a little bit better, and I'll look back in 10 years and be like, wow, look at how far I've come. Because even in just like the 13 years of diabetes, it's come so far. Yeah. The fact that I have an insulin pump on my hip and a continuous glucose monitor that works and works well is just amazing. Yeah. And my husband is so early in his diagnosis with his bipolar. He's just like, I don't know. I can't function. I can't do anything. And like, it's so like both chronic illnesses, right? His is not going to go away. We have to figure out how to deal with it. And I just take on that motto, and he has not yet done that. So hopefully one day he will. But I think you really do just have to like be honest with yourself and tell yourself that like, this really sucks. Yeah. And I don't have answers right now. I don't have a way that is conductive to actually having sex that will work with my husband, but maybe in a couple of years everything will slow down, and hopefully we'll be able to have sex. And it kind of is what it is. And possibly having the new diagnosis of PCOS, which I'll find out today, is just like, well, yeah. Just God damn it, yeah. Another goddamn thing, right? Sorry, I don't mean to say that like that. Fine. But like, one more thing, like, and we had our anniversary the other day, and our dating anniversary, and I had that day gotten back the high testosterone. And I was like, I don't even feel like a woman anymore. Like, I can't have sex. I now have more testosterone than I have estrogen in my body. I already have an IUD. Like, that was one of the immediate things I did when we got together. I was like, we're not having children until, if we can even have children. I was like, we're not having children until I'm done with nursing school. So I'm getting an IUD and going off of oral birth control. And the main factor was like, I'm allergic to latex, and non-latex condoms are so expensive when we were trying to have sex. And so I got an IUD, and even with the IUD, my testosterone is like through the roof. And I'm like, when is this ever going to just stop? And I sat there, I was all pretty, I was in makeup for the first time for a year, and I started bawling at dinner. And he just reached over and grabbed my hand, and he just sat there and was quiet. And I had my little moment and I wiped my eyes and I was like, all right, let's change the conversation.
What were some of the things that led to you thinking you might have PCOS?
Oh, in May, I had bilateral upper and lower, like it feels kind of like an electrical socket is hooked up to my nerves. That just happened literally overnight. It was the legs one night, and then the following morning it was my arms. And then June 6th, I was at work and I was charting, and my middle finger became completely immobilized. And then it spread to all of my fingers on my right hand, and then my wrist got contracted in a very weird position, kind of like it was sitting on a mouse as well, and it got stuck like that. And so we went to the ED because at that point I had to leave work, but nothing was resolving it. I couldn't move it. I could not move my fingers. I could not move my hand by myself. I could not move my wrist, but I could move my elbow on that right side. And so they did an X-ray, they did CT scans, they did an MRI, and they were like, we can't figure this out. Here's a brace. Here's a sling. Go home and follow up with these doctors. So one of them was a neurologist. And now I forget your question. What was your question?
I was wondering about like what you saw about PCOS, like what made you think that
Oh,
way?
yes. So the neurologist was like literally spent an hour and a half in the room with me a couple weeks ago and was like, I think it could be sleep apnea. He was like, it could be neuropathy. It could be MS, which it was not MS, thank God. Nothing against MS, but we don't need another autoimmune disease. He goes PCOS because of the fatigue you always have. And did I say sleep apnea?
Yeah, you did. Okay.
Sleep apnea.
Okay. All right.
So he ran a bunch of labs and the testosterone came back high,
right.
and said, here you go to a gynecologist.
All right. Well, I have one last question for you and then I can let you go.
Oh, you're fine.
So, I'm wondering, how do I wonder this? Your husband, has he been depressed most of the time you knew him? You just have a diagnosis of bipolar now?
My husband has been clinically depressed for, my God, how old were we? We were 15.
So do you, okay, that's fair. So how do you make a decision to be with a depressed person? Is it you love them before you know, so then, or is there any piece of like you feeling like there's so much wrong with me and he's accepting of that, I need to be accepting of his thing? Like, what's that dynamic like? Does that make sense? That question?
So yeah, we were together like our freshman year of high school, and then his parents were going through a nasty divorce. His mom moved to Indiana with him and the rest of the kids, right? So they were there for 10 years, and we've been best friends, like we ended our relationship fine, whatever, we were 14. And we've just been best friends, and we'll talk to each other throughout it. And like he would always come to me with things that were going wrong in his relationships, and I'd be like, dude, you gotta like fix yourself, like you're kind of the problem. And eventually his girlfriends would ditch him. And so that went on for 10 years, forever it seemed. And then my parents left for Indiana 10 years ago because of my dad's job. And my boyfriend, previous to Kyle, just ditched. He just like stopped responding to any of my text messages, and I couldn't get a hold of him. He's alive. He's still friends with my sister's husband. But just completely dropped off the face of the planet for me. And my husband, I was talking to my husband now, and I was like, I don't know what I'm going to do. Like, my parents are literally leaving in a week, and like, I have no place to live. And he was like, I'll just come be with you. And I was like, all right. So I got on an airplane and we drove home And we've been together since. But like, I knew he had depression. I didn't know the extent of it.
Right.
Right. Because like, if you're talking to somebody over text message, it's completely different than actually living day to day.
Sure.
You know, and so he came in June that year, 3 years ago. And so our winter here gets so bad. Like, you literally will wake up, the sun doesn't rise until like 9 a.m. I feel like it's probably not right. And then it's gone, you know, like we have a couple of hours of overcast. And so it got really bad, and I would come home. I was in school. I was finishing up my prereqs for nursing. I was still working full time at that time. So I was working 12-hour shifts. And I would come home, and he was working at Lowe's then, and he would just be in bed, and he hadn't moved if he wasn't working, or if he had gone to work, he would come home and immediately go back to bed. And I was like, this is not acceptable. And I was like, if you want to stay with me, you need to go get help. Like, you need to go to the doctor and either get some sort of pharmaceutical help, and you need to get a therapist, and you need to start working through your like, this is not acceptable. This is not how a normal person lives their life. And it's not okay. Like, I cannot be at school, I cannot be at work worried if you've even gotten up to like eat today, basically. Right. And I do like all the cooking and all of the cleaning and the making of the food, just because I'm so particular with what I eat, and I need to know the amount of insulin I need to take, you know. And so he was like, fine. And then he got on meds. So he's been on meds for 3 years, but it just has continuously gotten worse and worse. And even with all the medications and the medication changes, and he started seeing a psychiatrist, who was like, yeah, I think this might just be your expectations with how you thought your life would be at this point are not how they are. I see this a lot in men your age. Try this medication. And it just, at that point, it's like, I love him. I adore him. And it's when he is okay and his mood is stable, he's totally fine. Mm-hmm. It's the depressive aspect of like, he gets so deep. Right. I don't even know how to explain it, that it's just like, and for me with diabetes and the lifelong illness, it's so hard to understand that, because I'm like, you just need to get up and go freaking shower. Go shower. Like, just do a normal thing. Yeah. And I'm going to be a nurse. I understand the mechanics and the science behind what's going on, but actually living with it
that way, right?
Right. It's so hard. Like, it's a hormone thing. It's an imbalancement. And that's what I tell him all the time. Like, what would you do if I didn't take care of my diabetes? Especially when things get bad. I'm like, if I didn't take care of my diabetes and I had to have, worst case scenario, something amputated, you wouldn't want to be with me. You wouldn't want to take care of me. Like, you wouldn't. You would end up regretting being with me at some point, whether it was a decade or 2 or 3, you know. I'm like, you are doing the same thing. You're not taking care of your illness, and you're not taking care of yourself, and you're not doing it justice to our marriage or to me. And that really resonates with him. And he's like, okay, I get it. I see it.
That makes him try.
Huh?
Does that get him to try when he's feeling better?
Yes. Yeah. And I mean, it will make him cry. Like, and I think that's like my big gun is like, hey, dude, like, come on, you see how hard it is. And I'm not saying that like your bipolar isn't hard. But like, you need to get out of bed. I know it's hard. I get it to an extent, but like, we have a life to live, and I'm not going to live my life like this. So you need to.
So no matter what's going on for you or for him, you want to just, whatever the best foot is, you want to put it forward.
Yeah. And my husband will say, if you were to ask him, me at my core, he would just say, she just never stops moving. Never. She's just go, go, go. But that's just, if I stop, literally, again, I would fall asleep for 20 hours straight. I wouldn't move. And he'll be like, can you just slow down for 10 seconds? Just slow down. Just be here with me. And I'm like, fine. Fine.
All right. Well, listen, you have done something here today that I appreciate very much. Honestly, being this like clear about all the different issues is a lovely thing you've done for everybody listening.
I do want to say, lichen sclerosis is actually, I asked the vaginal dermatologist, I asked her, what population of people with lichen sclerosis do you see have diabetes? And she told me 90%, whether that's type 1 or type 2. She goes, usually it's later in life, it'll pop up and they will get it. Because again, it's an autoimmune issue. It's the immune cells are attacking the skin, and it's crazy. And so, if you're going to a dermatologist, women with type 1 diabetes, if you have children, you probably don't have to worry about it. Please have them look at your skin, your vaginal skin. You have a higher rate of having lichen sclerosis because you have type 1 diabetes, and then lichen sclerosis, if it goes unchecked, and we're talking like 20, 30 years, if it goes on without being treated, you have a higher chance of getting squamous cell carcinoma, and it's so hard to treat. So please just have your dermatologist look at your vagina.
Yeah, that's it. That's our takeaway. Have your dermatologist look at your vagina. That's definitely right. Yeah, 100%. I think that's a great
and get a biopsy. Please get a biopsy first. Don't start treatment without a biopsy. That would be it too.
All right. So listen, next time anyone calls with one of these ideas, we can't do it this early in the morning. But I was like, as we're talking, I was like, I looked up at the clock and I'm like, it's not even 9 a.m. yet. At one point, I was thinking, but it's important to talk about. And I really do appreciate you doing this. I want to wish you luck at your doctor's appointment today. I hope you get good news.
Yeah.
You don't think so?
I mean, it's pretty definitive. Yeah. It's not like, I've had ultrasounds before, and I do have cysts that are on my ovaries at all times. So, it is what it is. Yeah. It's just like, how will we treat it? Situation. So,
all right. Well, I hope you get good answers, and I really appreciate you doing this. Thank you.
Thank you for everything that you do.
Oh, please. If you thank me, I'm going to be upset. It's okay. You don't need to thank me or anyone else, by the way. You have a pass on needing to thank people. You've got enough going on. You don't need to worry about me. That's fascinating. Like it really is something. Your parents still in Indiana?
Yeah, they're still in Indiana. They're still there.
Gotcha. Okay. So you're up there. Oh, by the way, is your vitamin D low?
No, that was checked too. Vitamin D is fine.
Interesting. Of all the things.
No, I know. Well, I've been taking vitamin D since we moved here.
Oh, you take it? Okay. How much do
you
take a day?
Yeah, I've always taken it. It was just something that they're like, hey, we tell people when they move here, you need to take vitamin D. Yeah. That and B12. Yeah. So it's just something that is part of my vitamins.
I take it myself. A huge thank you to one of today's sponsors, Gvoke Glucagon. Find out more about Gvoke HypoPen at gvokeglucagon.com/juicebox. You spell that GVOKEGLUCAGON.com/juicebox. I also want to thank TrialNet for being a sponsor of today's episode. Go to trialnet.org/juicebox to get started. Don't forget to tell them that the Juicebox Podcast sent you. Thank you so much for listening. I'll be back soon with another episode of the Juicebox Podcast.